My name is Eva Grekowitz and I'm a physician here at the Institute of Allergology at Charité in Berlin. On behalf of my co-authors, I would like to present the findings from our Phase 2a study which assessed the effects of Izuforant, a histamine 4 receptor antagonist, in patients with cholinergic urticaria, a common type of chronic inducible urticaria. Why did we conduct this study? Targeting the histamine 4 receptor has shown promise in preclinical and clinical studies of allergic and inflammatory diseases. Izuforant is a selective oral H4R antagonist with inverse agonist properties and expected dual antipyretic and anti-inflammatory effects. In various preclinical studies, Izuforant bound to the human H4R with high selectivity. In functional assays, it potentially inhibited intrinsic activity and the effects of histamine on the H4R. How did we do it? We conducted a Phase 2a randomized double-blind placebo-controlled multicentre crossover trial study. We assessed the effects of Izuforant 100 mg in 19 cholinergic urticaria patients with an inadequate response to one standard of high-dosed antihistamine treatment. We used a battery of validated outcome measures which covered symptom control, disease severity, provocation response, and quality of life. What were our main findings? The change from baseline in urticaria activity score after provocation, which we call the URS-PROVO, the primary endpoint, and the most pre-specified exploratory endpoints were not met. There was a clear variability in the change in absolute URS-PROVO between individual patients within a treatment group regarding the extent and the course of the change. There were significant improvements in the patient's global assessment for Izuforant versus placebo. Izuforant was well tolerated. Adverse events during the treatment period were mild and there were no severe adverse events. Regarding pharmacokinetic, pharmacodynamic, and biomarkers, plasma concentration varied, mean IgE changed slightly by the end of the study, while absolute IgE differed greatly between patients. Izuforant did not change the expression of H1R, H4R, and did not downregulate H4R. Why is the study relevant to dermatologists and patients? In recent years, several H4R antagonists have been tested in preclinical and clinical settings in a variety of allergic and inflammatory diseases. But this was the first therapeutic trial assessing an H4R antagonist in cholinergic urticaria or any type of urticaria. Preclinical data strongly suggested involvement of H4R in skin inflammation, indicating H4R as a therapeutic target in diseases with itch and pain, like cholinergic urticaria. Izuforant was not more effective than placebo in our trial, but it was safe and well tolerated. Our results encourage targeting the H4R in other diseases characterized by histamine-driven itch and pain.